Afternoon, Leah. Thanks for having me.
How are you feeling about this bump? Does it feel like a real game changer?
It's certainly a level above anything we've had for many years, and certainly reflects how hard a lot of us have been advocating for the fact that general practice is the foundation of the health service and has been struggling to recruit and retain its professionals because of the funding constraints.
To get the full funding, though, and I mentioned it in the intro there, Luke. You know, there has to be some targets that GPs must hit, and can we take a look at some of them?
Yeah.
One is giving 95% of babies in their care their 6-week vaccinations by the time they're 3 months old. Is that realistic for GPs that might only have a few babies on their books, but also especially with changing attitudes around vaccines?
Yeah, no, I think it's going to be very, very hard, and it probably isn't. And that's not because of the work being done by general practice. It's because there is a hangover from the COVID days and the mandates, which have made it incredibly difficult to reach some families out there around the need for vaccinations for their children. There is a proviso that a 10% improvement would also get you funding, but again, that 10% is a decent chunk of children. So I think that will be particularly hard to reach that level of funding. Yeah.
Yeah. Another incentive relies on doctors signing up to give general, non-medical specific data to the government. I mean, is that something GPs and the public would be comfortable with? What does it mean?
Yeah, well, we need to get the devil's going to be in the detail. We're being told it's for the sort of planning of the health system and understanding where the need is, and I think that if that is the case, then most people would be comfortable with it. But we have to see what that detail is. Certainly, there is about 3% contingent on that being met by practices.
Yeah, right. How realistic are the performance targets being set, Luke? Because I know it's just been announced. You've probably got to, like you said, the devil's in the detail. But do they reflect what's actually achievable in a busy practice, or will it add just extra pressure?
Oh, look, the baseline 6.4% is welcome. That's higher than we've had for a long. Is there? That's definitely there. I think the 3% of the data sharing looks very doable. And so I think most practices are going to see over 9%, which is definitely a step in the right direction. The targets, particularly on immunisations, is going to have some graduation, and there is increased payments for the IMs that are given. So that is welcome. But given that the money has been assigned to primary care, we would like to see any underspend from the immunisations one in particular focus back into general practice and other work that we do.
So it's good then. You're saying the baseline, most GPs will see over 9%.
Yeah.
How will this break down for the public? Will we see shorter wait times to get to see our doctor, more appointment slots opening up? What's kind of the end game?
And that is the end game. It takes a while to trickle through as to how that's going to be achieved. I mean, bear in mind that the data of the Superior report and the like has clearly shown that actually quite a number of practices were just not financially viable going forward. So some of this is just going to allow them to stay open. What we're hoping it will do is see us be able to pay our nurses more, be able to pay our doctors more, which means we'll be able to retain them in general practice, stop them from hopefully heading over the seas to Australia, and hopefully attract some juniors in, because there will be some slightly better remuneration and conditions that we can apply.
Right. So you're saying it's a long game. We won't see it happen overnight, but would it affect the charges? What the GP charges a patient?
It's not going to result in a decrease of it, because we're sort of a co-funding model. So there's the amount the government gives and then the amount the patients pay. We know that for children there will be no increase. They still remain free under 14s. For community service card holders, that's going to sit at $20. It's been at $19.50 for 6 or 7 years, so a very small increase. And for the rest of the population, that in order to get the capitation uplift, fees need to be capped at a 3% increase. So it is. You are going to see less of a rise than there was last year in fees. It means we don't have to transfer fees to patients in particular, but initially there won't be a big drop in what user pays.
Oh, okay. Are we still seeing a growing gap, Luke, in access, say, for a lower income or maybe rural patients? Is this funding going to close a gap there at all?
There's definitely an amount in there for rural practices, and that's really important. We know that those practices often really struggle because of a critical numbers issue. If you're a rural practice and you're serving a population of only 2,500, 3,000 people, you're not going to have more than 2,500 or 3,000 patients,
Yeah.
and that becomes quite difficult to staff. So this funding there is particular amounts reserved for that, which will really help. By keeping the costs low for community service card holders, that really does help with access. We are seeing that unfortunate gap growing between the community service card holders and the general population, where if you're not quite eligible for community service, it's a big jump from $20 up to sort of $65 for a lot of people.
Yeah. A couple of other things, Luke, while I've got you. Last week we saw the announcement of, it was actually from David Seymour, about melatonin being made available, now at the pharmacy. What do you make of that? Good thing?
Melatonin? Yeah, I think it's a good thing. It's a safe medicine. Pharmacists will know how to counsel patients on its use and making sure it's not overused, or if there's underlying issues that need looking at. So yeah, I think that's a positive thing for the population.
I spoke with a pharmacist actually about it, and I asked her if would they like to see maybe more medications being able to be prescribed, well, not prescribed, but actually over the counter. And she said she thinks there is still some wiggle room for more, and it would take the pressure off GPs. Is that something you would also support?